Hi, everyone. My name is Catherine Crosby. I am the owner-operator of Bodyworks Med Spa and Wellness. Thank you for joining us today. I'm going to quickly introduce what we do at Bodyworks Med Spa and Wellness, and then I'll hand the mic over to Dr. McClelland, who will tell you all about Exomind TMS and mental health. So at Bodyworks, we use premium, non-invasive solutions to help people make aesthetic and wellness improvements that enhance their confidence and quality of life. Our services include Exomind TMS, which Dr. McClelland will tell you all about shortly. We have a device called the McClelland chair. This is for pelvic health. It strengthens the pelvic floor to improve a number of conditions, including urinary incontinence. It helps people sleep through the night because they don't get up to go to the bathroom as often. It improves surgical outcomes. There's all kinds of stuff that MCELA helps with. MSculpt Neo is a body contouring device that strengthens muscle and reduces fat. I have another body contouring device called Exilis Ultra, which reduces up to 2 inches of fat in the treated area and improves skin quality. And last but not least, we have a laser called Clarity 2, which we use for laser hair removal on all skin types. And we also do skin revitalization. So this is a photo of Dr. McClelland giving me an Exomind TMS treatment. Just as a kind of teaser for the presentation, I'd like to share my experience of doing Exomind TMS. So I started my initial treatment plan, my series of 6 treatments back in October. This is about 8 months ago. And I was hoping to get improvements with my insomnia. I have suffered from insomnia for most of my adult life. At times it has been debilitating, and I could not have imagined how Exomind TMS would change my life. After my first 2 treatments, I noticed a shift in that I had improved mental clarity. So what that meant for me, it was like my brain was just working so much more efficiently than it had been. I was way less forgetful. I could walk into the pantry and remember what I was looking for. The second shift I noticed was improved emotional balance. So I was much better able to cope with the challenges that life was throwing at me, that life throws at all of us. And the third shift I noticed very shortly after my 6th treatment was that all of a sudden I was sleeping so much better. So previous to doing Exomind, what my nights looked like was, going to bed, staying awake for probably hours before finally drifting off to sleep, only to wake up for no good reason at 3:30 in the morning or so. And then I was unable to get back to sleep at that point. So I was running on very little sleep. After doing Exomind, I would fall asleep more or less when I went to bed. I would stay asleep all night long. Or if my little kids woke me up in the middle of the night, I was able to get back to sleep after that. And then I would wake up in the morning feeling rested and restored, which is, at the time, that was a foreign feeling to me. It had been a long time. And an unexpected benefit of doing Exomind TMS for me was that because I was sleeping well, I was able to cope with my chronic pain a whole lot better, and that pain is much less intense. So happy to report I am still sleeping much better. And needless to say, we are very excited to share Exomind TMS with more people. So without further ado, I would like to introduce Dr. Christine McClelland. Dr. McClelland is a medical doctor, a psychiatrist. She has a master's degree in medical neuroscience. She has special training in TMS and ECT. She is the medical wellness director at Bodyworks Med Spa and Wellness. We're so happy, so lucky to have her at Bodyworks. And she's also the assistant clinical professor at the Department of Psychiatry at Dalhousie University. So, Dr. McClelland.
Okay, thank you, Catherine, and good morning. So I'm pleased to talk to you today about Exomind TMS. So you just heard from Catherine a little bit about her experience with Exomind. And this really is a new frontier of wellness, but as you'll see in the talk, based on a very old, reliable evidence-based treatment that we've known about for the past 40 years. So this morning, I'd like to cover a few things. We'll talk a little bit about mental health versus mental illness. This will be with the concept of mental wellness. And we'll answer the question, what is transcranial magnetic stimulation? This TMS term we keep referring to. Once we understand that technology, we can then talk about Exomind, which is a new and improved version of TMS. Then we'll touch on the treatment path to improve mental wellness using Exomind. So I'll review how you can get Exomind treatment or how someone you may know could access this treatment. And throughout the presentation, you might be wondering, could Exomind be right for you or someone you know? So as we're all likely well aware, mental health is one of the top concerns for adults in Canada in terms of medical issues. We do know that 3 in 5 Canadians report that their mental health symptoms affect their daily functioning. A high percent, 41% in fact, of adults who actually have diagnosed mental health conditions report that their needs actually went unmet within the last year. So we know we need more access and more options for treatments. So when we speak about the term mental health, we're referring to a state of overall psychological being that everyone possesses. Mental illness typically refers to a condition that's actually diagnosed, and it significantly impairs daily functioning. So you can have poor mental health while living with a mental illness, or you can have good mental health while living with a mental illness. Similarly, you can have poor mental health without actually having a diagnosed mental illness. So here today, we're seeing a lot of exhibitors with treatments for mental wellness. And we know that mental wellness is more than just the absence of illness. There are many components to this. So we think about emotional stability, adaptability to change, decision-making, stress management, maintaining positive relationships, pursuing goals and passions. And we do have several treatments and a lot of different categories available to help people with their mental wellness. To name a couple, so as a psychiatrist, I often end up seeing people once they already have a mental illness. So we often use antidepressants. And antidepressants, of course, can be very powerful treatments, and they're very powerful tools. They're often life-saving, but sometimes they're not effective enough, and sometimes they cause trouble for people. So we think about side effects, things like weight gain, things like sexual side effects. Other treatments you may have heard of, ketamine treatment, also another powerful tool with emerging evidence that we're seeing around lately. Then we think of things like therapy and counseling, which are helpful, meditation, stress management. We could put exercise on that list, many, many things. So then when it comes to transcranial magnetic stimulation, this is really in its own category. And that's what I'm about to tell you about today. So what is this? So in order to understand this treatment, we'll just discuss sort of the basics of how it works. So we know that a coil of wire with rapidly changing current, it creates a magnetic field around the coil. When the coil is applied to anything that can conduct electricity, such as biological tissue, it induces an electric field. And when applied over the brain, TMS coils induce electric fields, which then stimulate and activate the neurons. And the brain has a lot of neurons, 86 billion in fact. And there are thousands of synapses in between. So the spaces in between. Neurons communicate with each other with tiny electrical signals through these synapses or spaces. The magnetic pulses actually stimulate nerve cells in the part of the brain which controls mood, as well as many other functions, as we'll see. And this area is often underactive in patients with depression. So this treatment is non-invasive and it's drug-free. It's been used since 1985 for the treatment of depression. It's time-tested and well-regarded in the medical profession in the management of treatment-resistant depression and some other indications as well. And it stands out because you can see there's no long-term side effects. So how does this work? So that magnetic coil we were just talking about gets placed against the side of the head, and then it allows pulses to safely pass through the skull into the brain. The pulses stimulate the neurons to fire, in a key area of the brain we'll talk about more called the dorsolateral prefrontal cortex. And that helps improve activity in brain circuits, help to restore mood, sleep, and emotional control. But a little reminder about what TMS is not, as is true for many treatments that we have. It's not a replacement for medical care, seeing your family doctor or mental health practitioner. As you know, mental health problems often have medical causes that require management. So just to name a few examples, we think about hormonal imbalances such as the thyroid, obstructive sleep apnea, anemia, low iron, and vitamin deficiencies. However, those things aside, and when they're addressed, we have a lot of data about TMS in treating depression. In fact, there's over 40 years of clinical experience with millions of treatments performed. There's over 17,000 TMS-related published articles. And we know that there's a very high success rate in TMS in treating treatment-resistant depression. In other words, in treating depression where medications have actually been insufficient or failed. We know that if you have TMS treatment, you're 5 times as likely to achieve remission of your depression. So pretty compelling results are possible. So you may be wondering, well, this sounds a little bit scary, where treating the brain, we're stimulating your neurons. So is this thing safe? And the answer is yes. It's very well tolerated. It's non-invasive. And there can be a little bit of scalp discomfort. Most patients think that it feels more like a scalp massage. So a few things that can happen in terms of side effects. Very, very rarely, there's an increased risk of seizure. But that's, again, very, very rare, but you should know about it. Very uncommonly as well, people can experience a little bit of nausea during the treatment. I must say I have not seen that. And again, just to highlight the lack of side effects in terms of no weight gain or sexual dysfunction. Often primary concerns when people do have some difficulties with their antidepressants. Okay, so we're leading up now to showing you the actual device. So Exomind, what is it? So everything I just told you is now applied to a new and improved device. So this is an optimized TMS device, and it can produce results faster due to the optimization of the technology within it. We know based on studies that it is more comfortable for patients, and it's actually safe for wellness indications. So I told you before that TMS was being used for more severe illness, as in treatment-resistant depression. But actually, this device has been cleared to be used in many other indications. It's FDA and Health Canada approved. It's more accessible and easier to access since you don't need a referral. And here you can see the device itself. You can see that it is compact and is quite comfortable. Okay, so just to talk a little bit more about these new indications. So when we say something is on label, it means that we have a really robust body of evidence that it's effective. So we can say, and this is actually Health Canada approved. So for conditions, major depressive disorder, obsessive compulsive disorder, binge eating disorder, and anxiety, we can say that there's really robust evidence that this has a good chance of working for your conditions. Now, I also told you that it's being used for wellness indications. So this would be considered off-label. What that means is that we don't yet have as robust evidence as compared to major depressive disorder. We treat things such as stress and burnout, insomnia. We're seeing really, really great results with insomnia. Postpartum menopausal brain fog, post-traumatic stress disorder, post-concussion symptoms, smoking cessation, addictions, and actually gambling disorder. It's also showing to be quite helpful in fibromyalgia pain and managing chronic pain. It also treats ADHD and is being used to enhance mental acuity. And there actually are some other emerging applications, more so in the United States at this point. So, for example, we have Serena Williams, who's currently using Exomind to help enhance her performance. So professional athletes are using this to try to optimize focus, performance, to get an extra cognitive edge. So what research do we have that is sound about what patients are reporting? So 90% of patients actually reported the treatment to be quite comfortable. 83% of patients treated with Exomind reported feeling less depressed and less stressed. 88% showed improved mental well-being scores. And actually 100% of patients showed reduced binge eating scores and food cravings. And it was found that actually patients lost on average 4 pounds just by using Exomind. And that would be a treatment course. So now we're going to hear from some of the patients.
Honestly, do believe that Exomind has changed my life.
Exomind brought my joy back.
It has been life-changing to me.
Kind of gave me a boost. Had a little happiness, you know?
I'm feeling a lot better.
I met a man. First time in 15 years.
I've tried all of the CBTs, the DBTs, the group therapy. No exaggeration, probably at least 25 different antidepressants over the years. And this had almost an immediate effect and a lasting effect, which was quite wonderful.
There's no drugs. You don't have to pay for counseling. You don't have to go sit there and share all your thoughts and feelings, but something happened.
Just overall happier. That's what I noticed, like immediately.
I think I allowed myself to be open for a new life coming.
It was really, really nice. It helped out a lot, actually.
I really felt it each treatment. I felt it getting better, and my happiness, my joy, everything came back.
Yeah, so a little bit more about how it works. So the key brain region I mentioned is called the left dorsolateral prefrontal cortex, which is a bit of a mouthful. But this area, the important thing to know about it is that it's important in emotional control, decision-making, and mood. And we know that when there's underactivity of this brain region, there can be diminished functioning in all of those areas. So Exomind actually stimulates this area, and this can restore emotional balance, improve cognitive function, among many other things. So how is it doing this? So it's actually promoting neuroplasticity, and that's basically the brain's ability to adapt, change, and rewire. And this results in rebuilding and strengthening weakened neural pathways. So basically, this is helping to retrain the brain to support healthier thinking patterns and, again, that emotional balance. So you might be wondering what the treatment actually feels like. So there's a tapping sensation, which we'll show you in a minute. As I mentioned, it tends to be very comfortable, and this is one of the improvements as compared to the older devices. Each treatment typically lasts about 20 minutes. It's a walk-in, walk-out procedure with no downtime. So you don't need any anesthesia. There's no medications involved. And after your treatment, you go about your usual activities. You can drive right away. There's no limitation there. So now I'm going to show you what the treatment looks like. And you might be able to hear the tapping. So as you can see, a patient just either sits down or lays down comfortably. The device is applied to the side of the head, and that's all there is to it. So at BodyWorks, we're trying to remove some of the barriers with Exomind and provide this kind of TMS treatment for people without having to jump through all the hoops. So we accept self-referrals. We also like to hear from GPs and other psychiatrists as well, but we like the patient to be in control of what they want, and if they want to pursue this treatment, we can take it from there. We're also happy to collaborate with GPs or other mental health practitioners who are already involved. And there's no wait time to access this treatment. Okay, so thank you very much. And I know Catherine's going to come up and just tell you a little bit about how to get in touch with us and where to find us.
Thank you, Dr. McClelland, and thank you everyone for joining us today. If you're interested in chatting with us, you might want to take a photo of this slide. A couple ways you can chat with us. You can visit our booth. We have mini consultations that you can sign up for throughout the day. You can also scan this QR code to go directly to our online booking platform and book a free consultation for another day. We offer in-person and virtual consultations. You can go to our website, bodyworksmedspa.ca, and click the Book Now button. That'll take you to the same online booking platform. We are located on Dresden Row in downtown Halifax, the Pete's Frutique building there. And you're welcome to follow us on Instagram and Facebook. Our handle is @BodyWorks Med Spa Wellness. Thank you.